Good morning, I'm Dr. Oltman from Pediatrics Northwest, and I'm here to talk to you about our circumcision procedure. You've chosen to have your son circumcised here at Pediatrics Northwest, and first and foremost, pain control is very important to us. We will use one of two methods to control your son's pain today. All providers will use an oral liquid that's a sweet, sugary liquid that will help keep his mind off the pain. Studies have shown that this oral sugar liquid can keep the pain controlled down. And then also, our providers will use one of two numbing methods for the private area for the procedure. We will use either injectable lidocaine, where we do two numbing injections into the penis area where the penis meets the body, or providers might use a topical ointment that goes on the area, and that helps keep the penis area numb as we do the circumcision. Once we're comfortable that your son's pain is well controlled, we'll go ahead with the procedure. And for our circumcisions here at Pediatrics Northwest, we use the Plastibell. There is another method called Gomco that you might hear of from other friends or families or in the hospital, but our providers here at Pediatrics Northwest do not use the Gomco device. We use the Plastibell, which is a small plastic ring. That plastic ring will go around the tip of the penis, and then once we have the plastic ring around the tip of the penis, a string will go around that ring, serving as a tourniquet to help us remove the foreskin. Once we have the ring in place and the string in place, we will then remove the foreskin, so your son will go home without the foreskin today. That is the circumcision procedure. The pain control that we do here in the office should last for a few hours after the procedure is completed. And then if you're at home and you feel like your son is having pain, first and foremost, I would try and feed him, I would swaddle him, I would just try and soothe him and talk to him, and he should be fine. By tomorrow, most likely, he won't feel any pain at all. This ring will stay in place for approximately 1 week after we complete the procedure. In about 1 week's time, that ring that's around the tip of the penis and the string will fall off. Sometimes it takes about a day or so after a week to fall off, but don't worry, sometimes it falls off as soon as 3 days after the procedure. Sometimes it takes up to 10 days to fall off. It really doesn't matter as long as it falls off in a timely fashion. If you feel like it's been 10 to 14 days after the circumcision and the ring is still in place and not really showing signs of falling off on its own, please come back and see the provider who performed the circumcision or one of the other doctors that does circumcision so we can make sure that it's healing appropriately. While the ring is in place, your son will have no problem having wet diapers. It's open on the end, so he'll be able to pee straight out through the end of the ring. So you should continue to see wet diapers, including on the day of the procedure. With a poopy diaper, he might get some stool on the actual ring itself, and it's important to take care of that. So with a wet wipe or a warm washcloth, you can gently clean the stool off of the plastic ring. Be firm with it, but not too firm. You're not going to dislodge the ring. It's going to stay in place, but as you keep it clean with a wet wipe or washcloth after a dirty diaper, get it all cleaned up, and then take a clear ointment. This could be Neosporin if you have antibiotic ointment, or it could just be Vaseline or A&D or Aquaphor, some kind of clean ointment that once you have that ring cleaned off, you're going to put that clear ointment around the ring, so the ring is around the tip. You're going to put ointment around the outside of the ring there so that it doesn't stick to the diaper when you put a fresh diaper on. You'll just continue to do that during the course of the ring being in place, and then after approximately 1 week or 7 to 10 days when the ring has fallen off, you'll no longer need to care for it as closely. Some bleeding can be expected after the procedure. So the day of the procedure, you might see a little bit of blood spotting in the diaper, and that is totally fine. Similar to the belly button, expect to see a little blood spotting in the diaper. If you see larger amounts of bleeding where it looks like it's actively oozing out, then you do want to hold some pressure. You can use a Kleenex or some kind of tissue. Hold some pressure on that ring, so you just put pressure on it with the Kleenex and firm pressure for 3 to 5 minutes. That bleeding should stop. If you have any concerns about ongoing bleeding or swelling in the shaft of the penis, then make sure to once again contact your provider here at Pediatrics Northwest, and we'll make sure that that's taken care of. Your baby is able to have a bath with the ring in place. I wouldn't recommend doing one in the first 1 to 2 days after the procedure, but after that, feel free to give a bath as normal as long as the belly button has also healed up. And then once after the bath, you would just pat it dry, apply your ointment, and then the diaper change should go on as usual. After about 1 week, when that ring has fallen off, you will see that ring fall off and into the diaper. Then it's going to be important to get in the habit of pulling the skin of the shaft of the penis back with diaper changes once the ring is gone to prevent the skin of the shaft from sticking to the tip of the penis. If you don't do that and the diaper is pushing everything together, sometimes that skin on the shaft of the penis can try and re-stick to the tip, and then we have to work to pull it back here in the office. If there are any concerns at any time of not being able to pull that skin back or see the full tip of the penis once the ring has fallen off, then please let us know. Before the procedure, your provider will ask you if you would like to join us for the procedure. You are more than welcome to observe us perform the circumcision, but you don't have to. It's an individual choice. You may or may not want to watch. If you would like to watch, please speak up and say so. We'd be happy to have you observe us, as we have nothing to hide during the procedure. We work very hard to keep your son pain-free during the procedure, and we will be with you every step of the way as it heals. And if you have any questions at all about the procedure, don't hesitate to ask before we perform it. Thank you.